Hi everyone, this is Sibo Zhao. I am the Medical Director of Neuro-oncology here at Cook Children's. I was awarded with an Endowed Chair program back in 2022 to bring focused ultrasound technology to our institution. And a lot of you may have not heard about focused ultrasound before or have questions of what this is. It's not just an ultrasound, it's not an imaging tool. It in fact is a innovative therapeutic technology that can help us deliver treatments to patients. It does not require incision, so it's incisionless. Focused ultrasound, it uses kind of MRI or CT for imaging guidance. And wherever the ultrasound waves meet and converge, it can very precisely delivers therapeutic effect or treatment to the patient. It can be delivered to the brain or the body or wherever the desired treatment area or the field is. And it works by a variety of different kind of mechanism actions. It can do thermal ablation. It can have targeted drug delivery as one way how it works. It can open up the blood-brain barrier. So among many, like a few other mechanisms of how it works. So focused ultrasound is a very innovative technology that I really believe, I think will be beneficial to our patients, and I wanted to be able to offer that service line here at our hospital, and that is the goal of this Endowed Chair program. So one of the reasons I felt this was a program that we need to kind of jump in on and start to invest in is because that will make Cook Children's one of the leading children's hospital in the country to offer focused ultrasound. And currently, I stay in touch and kind of within the small community that are interested, but currently, as far as I know, there are only 6 pediatric hospital or children's hospitals in the whole country that has focused ultrasound device and is doing research in this area. And currently there are none in the state of Texas. So this will make Cook Children's the first hospital in the state of Texas and the only hospital in the state of Texas to offer focused ultrasound technology at this point. So as the survival for pediatric cancer has overall significantly improved in the last several decades. There are still many patients with cancer diagnosis that have very dismal outcomes. One that's close to my heart is a population of patients with the diagnosis of DIPG, which is diffuse intrinsic pontine glioma. This is a diagnosis, unfortunately, we don't have a cure for. And so as part of this Endowed Chair program and bringing focused ultrasound technology here, the first patient population that we will be having a research study on is to see how we can potentially benefit and improve the outcome for patients with DIPG. But there are many other brain tumor diagnoses, such as high-grade glioma, diffuse midline glioma, and a lot of my patients with relapse, recurrent, malignant brain tumors. They also don't have great treatment options at this point. So those are patients and areas of research that I would love to explore in the future. So as neuro-oncology, as the program neuro-oncology grows here at Cook Children's, I think research is a very important aspect of our growth. We are very busy clinically. We have lots of patients, and but I think to really make us stand out and gain additional national recognition and enhance our reputation, a research like this in focused ultrasound will really kind of put us ahead and at least make us more recognizable nationally. Another thing that I hope to improve for our patient care here is really what we can offer to our patients. Some of these kids, like I mentioned, who have terminal diagnosis or brain tumors or other cancer diagnoses that are not curable, they frequently have to make the difficult decision whether they want to travel to another city or state to receive experimental treatments and clinical trials. And I think having some of those own research and early trials here, right here in Fort Worth at our hospital, gives patients and families the opportunity to stay local, and also as the communities, for the family communities on social media and their supporting networks. And I know a lot of my patients are connected to other families with similar diagnosis. I think the words will get out there quickly, and I think we'll get tremendous number of referrals regionally, nationally, internationally, and we'll quickly grow our program and bring patients from all over who want to pursue focused ultrasound treatments for their child. You know, when I first applied for this endowed chair, obviously being a neuro-oncologist, the patients that I'm closest to my heart are brain tumor patients. But you know, the focused ultrasound, it's a much wider field. So when I look into the possibilities of using focused ultrasound technology here, I research what's currently being done and what's out there, and especially in the adult population, I realize just how widely applicable this is. There are adult research in neurology or neurological disorders, in epilepsy, in movement disorder, dystonia. There are other research in, pain management, neuropathic pain, and in areas like endo, GI, cardiology. The list goes on and on. So when I applied for this endowed chair, of course, I focused on brain tumors and oncology patients, but I did, joke about how we should dream big, because I think that this technology potentially can really be explored by other specialties and other departments and investigators who want to, come up with newer treatment options or do research that can potentially benefit their patient populations as well. So I think it's a very exciting time.